Hi everyone, we will speak about vertebral column. Vertebral column is also known as the backbone, spine. It is a bony structure found in vertebrates. It is completely formed of 34 vertebrae. It is classified into cervical, thoracic, lumbar, sacral and the coccyx. Cervical. We have cervical 7, thoracic 12, lumbar 5, sacrum 1 to 5, coccyx it's the last, and it is also called as a tailbone. Cervical we have C1, C2, C3, C1, C2, C3, C4, C5, C6, C7. C1 is also called as atlas, C2 is called as axis. C1 is the only bone which has no body. C1 or atlas, it is a superior view, inferior view. Superior view and inferior view. Atlas is the topmost vertebra along with C2. It is a connecting between the skull and our neck, skull and the spine. It has no body, and this is due to the fact that this is fused with the next vertebra over here. This anterior articular facet, this arches with the articular facet of the dens with the atlas. So these both form a fusion, and then there is an articulation with between these two. This is axis. This is having a pivot with which articulates with C1, and then it rotates. This is a distinct characteristic feature of this axis. This is it has the strongest odontoid process on which there is a dens. It forms the upper surface of the body. Deep in that, behind this anterior arch, this articulation forms the movement due to which we can turn our head. This is up and the front of the third vertebra. It also has a continuation with the third vertebrae over here. You can see upper cervical vertebrae like this dens, which is articulating with the atlas over here. Then this is the axis, third, fourth and all. Okay, generally speaking about the cervical vertebrae, we have tubercles, anterior and posterior, which are present on the transverse side. We have also between these two tubercles, you see this foramen transversum over here, this part, and then this is the vertebral foramen through which our spinal cord passes. The unique character of the cervical vertebrae is the spinous process. We always have a bifid spinous process which are unequal in shapes. See, everywhere we have this bifid spinous processes. This is the body which is absent in atlas, which is present. We can see it in the 7 cervical vertebrae over here. We have a long spinous process. This is the laminar part which is present posteriorly. Then the uncinate process which is present just towards the body over here. You see the side pass. The uncinate process, the transverse process, this the facets, the peduncle which is present between the transverse foramen, this over here, peduncle, the articular surface for all the uncinate processes on either side. Then we also have the groove for the spinal nerve through which our spinal nerves pass through this. And the uncinate process over here, we have articulation on all sides. Like here, C4 uncinate process for the cervical 4, cervical 7 uncinate process, vertebrae on different views, different like superior view, anterior view, we can see the uncinate process. And this is the lamina, as already said, vertebral foramen, the pedicel which acts like a joint between these two parts, the posterior and anterior tubercle which forms the transverse process, the costal lamellae between the two tubercles, the costal lamellae, the foramen transversum between this vertebral body and the transverse process, and the facets, inferior articular facet. This is the inferior articular facet, and the process, this is the process. Coming to C4, this is the superior articular process and inferior articular facet. This is the facet, this is the process, this is the process. This comes like a tubercle, something like a tubercle. This is the process, and the facet is always comes like a concave process, just like that. Posterior tubercle and anterior tubercle in different view, like this is the anterior view. Yes. Then this is about something about cervicals. C6, always remember about the carotid artery because it has a process through which the carotid artery passes. C7 is always remember for its cervical prominence. It has also difference in its spinous process. C1, always atlas, no body. C2, axis, presence of odontoid process through which it articulates with the atlas. Always the bodies are small in the cervical. The upper surface has the concavity transversely, but the lower surface has concavity front to back. This lower surface is from front to back. The spinous process is always short, bifid and unequal.